Hi there, everyone. Thank you for joining. This is Moses, one of the co founders of OSTI. OSTI is a medical platform to help connect Cameroonians with healthcare professionals for advice, consultation, follow up, monitoring through a digital platform that is mobile and web based. This is a not for profit venture with the objective of leveraging technology to provide accessible and affordable medical care to all Cameroonians. And our prime vision is to reduce the mortality rate in Cameroon and help Cameroonians become hopeful of their medical services. But before we got here, it's because there has been a recurrent problem in Cameroon. And this problem is that of healthcare accessibility that is linked to geographical barriers. Cameroon has two major cities, Douala and Yaoundé, and all the best infrastructures in healthcare are located in these areas. And so people live from thousands of kilometers to come and consult in Douala or Yaoundé. And when they arrive Douala or Yaoundé, they tell them, look, you don't have access to seeing the doctor today. You can wait maybe for the next 1 week or two. And we know that when it has to do with healthcare, just a second wasted is very, very crucial and very important. And so that is why we are building this solution, a solution that will help link healthcare providers and healthcare seekers, and in fact, all the stakeholders of the healthcare sector in Cameroon, so that they can share information and know what to do in the case when somebody needs an appointment, follow up, or can be looked upon remotely. And that is the solution that we are trying to provide right now. And we are looking at starting first of all with Douala, because that is where the market would start from. Douala and Yaoundé, these are the two major cities, and this is where so many people have access to internet and they are educated enough. So we start with Douala and Yaoundé, and we look at the internet penetration level in Cameroon. We are expected to start with about 5 million people in Douala, and we are hoping that we will get first of all 13% of this population, and within the first 3 years then we'll cross the chasm and then we'll move to the 34%. This will be the early adopters, and then we're also looking at hospitals joining us, insurance companies, pharmacies, you name them. And for us to do this and be profitable in it, we are looking at a revenue model. And our revenue model, we have divided them into three different sources. We will have our first revenue source would be from subscription fees. So companies will register with us, individuals will subscribe with us for a period of 2, 3 to 5 years. And this will give us some minimum running capital. And then also the second source of revenue will be from transaction fees. People will pay us a transaction fee for whenever they have a transaction for those people who have not registered with us. And then lastly, we'll be looking at adverts that will come from our partners, industry partners, people that we work with that can advertise on our web page. And so that will give us some little cash. And for this, we are working, two of us in this project. We have Moses Ngwana. I'm a Cameroonian. I've lived in Cameroon and I have international experience working outside Cameroon in Africa as well. And I understand the problems in Cameroon. And I've also had experience in so many startups, so that's why we think that we can leverage on my background and also work on this project. And also Denis Treska, he's an American with a specialization in information technology. This will help us build a user-friendly application that every other person would use. I mean, even the people that have not gone to school or are not highly educated, they can use this platform for medical attention. And before we were doing this, we also had done a lot of MVP experiments, customer interviews to validate what people want. If at all they have this as a problem, yes, we validated that there is a problem. Do they need a solution? Yes. And how much are they ready to pay for this solution? We all did this and we saw that this is worth investing. And so that is why we are presenting this to you today, because out of this project we have already raised 20% of the needed capital, because we need operating capital for the first 18 months, and we have already had 20% of that. So we are seeking $1.2 million that will help us grow in this project. And I can assure you that if you invest in this project, you'll be saving a life in Cameroon, and this will be very, very important. And trust us that we are going to manage it as professional as we can. And so if you have any question, I'll be ready to answer. Thank you.